Welcome to the Mind Myself podcast. I'm Esther, and it is my pleasure to be bringing you information about healthcare approaches, health issues, and people's health journey stories, all from the complementary, holistic, and integrative perspectives, helping you become your own best health advocate and helping you make your own informed choices because you matter. Welcome to the Mind Myself podcast. I'm Esther, and I have the pleasure again, we've done another recording as well, but of welcoming Darren McConaughey back to our conversations. Welcome, Darren. Can you tell us a little bit about who you are and your credentials, please, just to put a context for this conversation?
Hey, Esther, thanks again for having me. This is my pleasure, and it's a great time chatting with you. My background's in athletic therapy. I'm also an osteopathic practitioner and a strength and conditioning coach. I blend the worlds of manual therapy and movement, and I do that in a process called reconditioning. I have a business called Reconditioning Hub.
Fantastic. So today we're talking about something that might be unexpected coming from a guy, but hey, that's awesome. We're going to talk about C-section scars in particular. So I know that C-sections are commonplace, and I haven't even really given them much thought before our conversation. And why is this so common? And maybe just give a little context about C-sections and what's involved.
Sure. And I think because they're so common, we sort of minimize the process a little bit and what actually is taking place. I mean, why are they common? That's a great question. I think I have my opinions on it, whether it's actual fact or not, but I'm willing to share my opinion.
Sure, that'd be great. Tell us your opinion.
I think there's a certain amount of business to birth, and I think there's time constraints. There's OR times, there's doctor's times, and labor isn't necessarily, childbirth isn't a schedule thing. It's not, things don't always work out the way a doctor's schedule may want it to, or a mother's schedule for that matter. And so C-section becomes something that we can plan. And so much of our world is, I need to control this and I need to plan that. And so unfortunately, in my opinion, I think that we've taken the birth process and tried to control it. And that results in more C-sections. That being said, there are always cases where there are emergency C-sections, and obviously saving the life of the mother or the child, and it's a necessary process. It's a necessary I hate the word, but a necessary evil, because it causes damage and causes some issues, but it is what it is. It has to be done sometimes. I think there's the necessity ones, and then there's the ones that we kind of the planned C-sections. But I also think some of those emergency ones are sometimes not as an emergency as what is led on.
Wow.
That's another conversation.
Another conversation we may or may not get into, depending on, I don't know, the political climate maybe. But, so what's involved in a C-section?
Yeah, well, obviously you have a child that needs to get out. So it's an incision made that cuts through multiple layers of tissue to access the child. And in the most simplistic terms, we're going through the lower abdominal area to remove the child instead of going vaginally or normal birth. And so what ends up, you create massive trauma to all the tissue that you have to cut through. And not to mention there's emotional factors. There's things that are very intrinsic to the birthing process that gets altered. And so the child's first experience into this world is one that is fairly traumatic. Now, even regular birth is traumatic on a child. but there's certain things that if you go, if a child's born vaginally, there's been even some recent studies that I was reading around your immune system and the mucus that when you exit through the vagina, your body gets covered in this mucus, and it's your first really introduction to or a supplemental layer to your immune system. It helps your immune system later. How much of that is valid? It's very preliminary, but these are things that I've read. And so I think the preference is always, if we can do a natural birth, that would be the preference. In circumstances where it's not possible, C-sections is an option, but recognize that it does have ramifications on the mother's body and potentially the child as well.
For sure. Now, let's talk directly about the scarring thing. You mentioned that there's a lot of trauma to the multiple layers of skin that have been cut through. Obviously, when a new mother has her baby, and it's a very trying time, beautiful time, but tiring and generally exhausting time. So what happens with the healing of that scar and maybe the beginning and then later and even further down the road?
Yeah, so scars are really interesting. C-section scars are super deep. And so you'll have multiple layers of that scar that start to heal the moment they're sutured. And the healing of it, the tissue starts to lay down according to the stress imposed on it. And so you take a mother that has just been in the hospital, maybe it's her first child, maybe it's her second, and she's got to go home and there's another child to care for. And so generally speaking, the instructions from surgeons are, well, rest, take it easy, and time will heal this. Time does heal. It doesn't necessarily mean that it heals well. And so that scar will continue to lay down according to stresses put on it, but often very haphazardly, because the stresses placed on it are haphazard, whether the mother's resting or she has to bend down and pick up another child. So you get this really messy scar tissue that's deep, and it starts to create pulls in many, many directions. And I mean, there's lots of great work being done on fascia right now. The last 5-10 years, I think the understanding of fascia has completely changed from, fascia being tissue more like a saran wrap that sort of encapsulated everything. Now we understand fascia to be much more contractile in property, so similar to muscle tissue. It has contractile properties, and it doesn't just surround things. It actually goes through everything. It goes through, around, in between, and so its connections are vast. So you can have fascia, that encapsulates the reproductive systems of a female that have connections into the low back, into the shoulders, into the neck. And so this tension from the scar that's cut through fascia has this pull on multiple areas in the body. And it doesn't happen right away. It's not like the mother's going to wake up the next day and be like, oh, I feel this pull from my C-section scar into my neck. It takes time. It takes years for this scar to continue to sort of lay down and create tension and pull. And so often what ends up happening is women have some sort of pain or problem many years later. Like low back pain is very common just due to the direct vicinity of where the scar is. But low back pain is very common. And so you come in and like, hey, I got low back pain, and they don't associate it at all with the scar that they had 5 years ago. So you've got a scar that is creating tension, a scar that is also going to start to shut down how the neuromuscular system operates, so the nerves. So you have, how important the, intra-abdominal pressure, and I hate the cliche word, but the core is to, stability in your low back. And so you've created a scar that is interfering with the proper neuromuscular function of this area. So you've got tension and interference in your neuromuscular system. Oftentimes pain is what ends up coming from these two problems. And so the scar, in order to undo that pain, we have to go back and start looking at, well, where is the scar pulling and how can we start to undo that?
Right. So if somebody has recently had a cesarean section birth, what advice would you give them to help heal and mitigate some of these things right away? And then we'll get to a more longer term question after that.
Yeah, I think number one, recognize that the scar needs work. Let it heal. Obviously, like, you don't want to go and start play around with that scar when it's still fresh.
Like
So,
how long? How long?
I would say give it a month. Let things just settle in, and then maybe go see somebody. Whether it's a massage therapist, an osteopath, somebody in that realm that has an understanding of how to work with scars, and then start to work on it. You can work it on you can start to feel it yourself and work on it yourself if you want. Like, get in, feel where the tissue moves and where it doesn't move, and just kind of gently take it in directions where it doesn't move and try to feel the tissue let go. You can do deep breathing into that area. So using breath to help stretch out some of the scar from deep within. So these are things that I would entertain considering at 4 to 6 weeks after the C-section.
Fantastic. And what about for women who may not have even thought of this, and their doctor and surgeon just said, yeah, okay, rest and let it heal. And now maybe they're experiencing some things either related to the scar, or they don't know that it's related to the scar. What should they be looking at, and what proactive things can they do to, I guess it's not proactive anymore, but what can they do to mitigate some of these things they might be experiencing?
Yeah, I think anybody that's had any surgery, but especially C-section surgeries, they need to consider the scar as being a potential cause of some of the symptoms they're having. And so if it's in your history, if you're a woman that's had a C-section and you're suffering from some ailment, and if that C-section was 10 years ago or 5 years ago or 2 years ago, you need to consider that the C-section is a possible cause to some of these symptoms. And so seeing somebody that is on the same page on that level, right, where they understand the ramifications of scars, I would highly recommend, and help sort through the details of, maybe this is the root, or maybe it's not, maybe it's something else, but it needs to be considered. It can't be assumed that it has nothing to do with anything.
Totally. So definitely seek help from a professional. And are there any things that people can do on their own scar? Like, is there any kind of massaging they can do, or?
Yeah. So like I said, take your own hand, feel the length of the scar, feel different portions of the scar. And if you can see my hand,
Yeah.
go up and down, find which one it does not like. Doesn't like going down, stay there. Go left, right. Which one does it not like? Doesn't like going here, keep it there. And then you can add twists, counterclockwise, clockwise. Keep it there. And then add breath into it. So once you've accumulated all that tension, just breathe into where you feel that tension and see if it starts to let go and relax. And once it does, find another spot and repeat, and just keep working your own scar. And you can do tremendous things with that. Like scars, the analogy I give people with surgical scars especially is it's like rust on a car. Once rust starts, it doesn't go away. You can sand it down, you can repaint it, but it's still there. And so with a C-section scar, you have to continually work on it. Once you can get it to a good place, don't get me wrong, like you can work on it and be like, okay, I don't need to do this every day, but you need to revisit it frequently. Let's say once a month, once you get it to a place where it's moving well, because that tissue is forever changed. Surgery forever changes tissue. It is what it is. And so you have to do some maintenance work on it in order for that scar tissue not to continue to sort of lay down thicker and haphazardly. So you continue to break it down and then move well. The more you move well on top of that scar tissue, the more the fascia is going to contract and adapt and build in a way that mitigates how that scar is pulling tension into different areas.
Wow, lots of food for thought again, Darren. It's been excellent to pick your brain on this. So if a woman is considering, say she's in her late 30s, early 40s, and she's either pregnant or about to be pregnant and considering a C-section birth, are there any cautions you would say? I know you've probably already given those, but are there some things that you would say?
I think ultimately everybody has to make their own choice on these things, but I would caution and ask that you look deeper into why you're planning that C-section. Is it for personal health reasons, or is it for a schedule? And I think if I could advise somebody, I'd say think hard and deep about that, and consider there's health ramifications to it, but there's also emotional ramifications to it for both you and your child. So I think there's a bigger picture to life than a schedule, and so my advice would be to really think hard about that.
Excellent. Well, thank you again, Darren, for being here and for sharing your wisdom and experience with us. Really appreciate that.
I appreciate the time, Esther. Thank you.
Thank you. And if you're listening to this and you want to find out more about Darren, definitely check his profile on the Mind Myself website. The information is below, or check out his website, and it's the Rehab Hub.
Reconditioninghub.com.
Reconditioning Hub. Thank you for that.
Yeah.
And the information is all below.
Awesome. Thanks, Esther.
Thank you. Thank you for being with us at the Mind Myself podcast today. We know that time is precious and you've spent some of your valuable time with us. We're grateful. If you would like to reach out to our guest directly, the information is below. And if you would like more from Mind Myself, that information is also below. Please visit our website and check out all the information about the different complementary, holistic, and integrative healthcare approaches, information about health issues, more podcasts, tons of blogs, and we even have a community page for you where you could reach out and tell your story safely, or you could ask questions and perhaps somebody else in the world is going through something similar to you. In any case, we're so glad you're with us, and we're doing this because you matter.